Good afternoon, everybody. I'd like to welcome you folks from wherever you're joining us to the 5th Media Dialogue from the East and Southern Africa Interagency Working Group for Risk Communication and Community Engagement, popularly referred to as RCCE. Today's theme is traditional medicine, science, and COVID-19. And we have two great speakers, Dr. Ossy Kasilo, who's the regional advisor on traditional medicine at the World Health Organization Regional Offices for Africa, and Dr. Jaya Shreedhar, member of the pandemic bench at Internews, and also a health journalist and trainer. So RCCE is made up of a number of organizations, which include UN organizations, Internews, IFRC, Save the Children, and like-minded organization, which are very much interested in rumor tracking down in the communities and also getting feedback. So the screen I'm sharing right now is showing us some of the feedback we've been getting from our partners from the ground with regards to COVID-19. As you can see, it has feedback about countries which came from Botswana, Burundi, Madagascar, Rwanda, Ethiopia, Malawi, Sudan, and the likes. And don't worry, I'll be sharing this presentation after today's session. So this is just to show you that this media dialogues are informed by the need which is coming from the ground. And then in the course of this conversation, we will have a poll which will be sent to you. Thank you in advance for filling that up. And in that poll, now we have the issues that we've picked on the ground, and then participants of this media dialogue will choose what the next theme is going to be. So without taking any more time, I'd like to set the ball rolling and go straight to Dr. Ossy.
I take this opportunity to thank all the organizers of this dialogue for inviting the World Health Organization to actually participate in this important discussion. 80% of the population in the Africa, Asia, and Latin America use traditional medicine for their healthcare needs. Africa harbors over 60% of medicinal plant species, and only 10% of these medicinal plants are scientifically evaluated for their potential. Over 25% of the Western medicine derive from medicinal plants, and Africa's indigenous medicine knowledge is not normally written, but transmitted orally from generation to generation. Now, because of this myriad of several African traditional medicine, the World Health Organization has put in place mechanisms whereby traditional medicine has to be governed by policies and regulatory frameworks, as you can see in the slide, but also has classified with the African experts traditional medicines into 4 categories, because otherwise you can't deal with them, and international requirements of safety, efficacy, and quality. The second category of medicines is of those used by communities. For example, in my village, we know how to prepare very well herbal medicines used for malaria. We must boil not beyond 60 degrees, otherwise the active ingredient will be inactivated. And these medicines are only used by my village, but if they have to be used by the whole country, they must comply with the safety, efficacy, and quality criteria. And the third category of medicines is from research and development. And research and development is the same as for modern medicine or allopathic medicine or Western medicine. And this is what we will be talking about when we talk about protocols and research. We are not talking about medicines out there that are being dispensed by the healer at the moment. The fourth category of medicines are those that are imported in the country. So the regulatory authority has to know why this medicine is imported in this country. Is it safe, efficacious, quality assured, and if it's not registered in the country of origin, could be China, could be India, could be Australia or any other country, why is it imported in this particular country? So I want to make it clear that these are the medicines that we'll be talking about. Now, I want to make another important point to say that traditional medicine has been recognized at all levels, at global level, at the African continental level, at regional level, and country levels, as evidenced by the declarations, the strategies, and recommendations that are adopted by these various levels. You will recall that the heads of state and government in Africa declared the first decade of African traditional medicine for the period 2001-2010 in Lusaka. And this was renewed in Namibia in 2011. So we are at the end of the second decade of African traditional medicine. And next year, the head of state, we have the information that they will renew this decade. Now, what is the WHO's role in all this? The WHO has to ensure that the medicines that are used by this magnitude of people, 80%, they are safe, efficacious, and of good quality. In order to do that, it develops tools and guidelines for researchers to actually conduct research in order to generate scientific evidence on these products. It develops also tools and guidelines, for example, for the prevention of biopiracy and intellectual protection of intellectual property rights, and also provide technical support to these countries and strengthens the capacity of the countries so that they will be able to use appropriately these tools and guidelines. And of course, the countries now will apply these tools, and if they need any support, request WHO. Therefore, this is the situation at the moment.
Ossy, if you hold on 1 second, I have a question. My name's David McDonald. I'm helping Tole with the moderating, and we do have some questions from the journalists who are attending this media dialogue. And I was wondering, after that nice introduction or overview of traditional medicines, we have one question. It's sort of like an international question, which is from Richard Philister. He wants to know, are African scientists collaborating with American and other international scientists to find a COVID-19 vaccine using traditional medicines?
As far as I know, before the COVID-19, I know that a lot of African countries were collaborating with various countries, such as the United States of America, Australia, Europe, New Zealand, and China, just to mention a few. And I'm sure that after this COVID, those African countries have enhanced collaboration with those institutions. And I know that there are countries that are collaborating with these outside institutions to find a cure from herbal medicines, mostly. There could also be some countries that are participating in this collaborative research for vaccines, but we will only be able to know next week from Monday to Wednesday. We are organizing a regional consultation on the contribution of traditional medicine to COVID-19, where countries will come together to share their experiences. And I wish to inform the moderators that I would like the journalists who are present at this dialogue today to participate at that meeting. And if you share with me their email addresses, or I'll share with you the links so that those who can, who had time, they can participate. And it will be from 9 a.m. in the morning to 12 noon in the 12 noon Brazzaville time. And this will be 11 to 1 o'clock East African time.
Thank you very much. We encourage questions, just throw them in the chat. And my colleague, David McDonald, who is co-moderating, will be picking them out as we move along.
This slide is showing you the implementation of the declarations, resolutions, and recommendations that I just mentioned in the first slide from the World Health Assembly Regional Committee for Africa. And it shows that over 90 herbal medicines have been registered by national regulatory authorities in our region with WHO support by 2019 as compared to only 20 in 2000. And over 40 of these products have been included in National Essential Medicines list as compared to only 14, meaning that they've been added to the arsenal of pharmaceuticals to improve access to medical products. There are 40 countries that have developed traditional medicine policies as a de facto sign that the member states want to promote and develop traditional medicine. There are 34 countries which are dedicated to traditional medicine research as compared to 18 in 2000. There are 24 countries that have integrated modules of traditional medicine into the university curricula of pharmacy and medical students, but there are more pharmacy than medical students, and we are advocating for more institutions teaching medical students to integrate traditional medicine in their curricula, because they should know from now what is the role of traditional medicine in health systems, and not only when they finish their studies, they are asked to collaborate with traditional medicine practitioners, and that's why sometimes, you know, they don't want to collaborate. There are 19 countries which are locally manufacturing traditional medicines in our region, and 16 countries have developed legal frameworks or policies for the prevention of biopiracy or for the protection of traditional medicine knowledge. And 15 countries have informed the World Health Organization that in the various surveys we carried out, that there is a two-way collaboration and referral systems from traditional health practitioners to conventional health practitioners and vice versa. But we know the reality is that there are more traditional health practitioners than medical doctors who refer their patients to each other. So this is the situation, how it was before COVID-19. So the World Health Organization has been supporting countries to conduct research even before COVID, as you can see. So it's not that, it is not because of COVID that WHO is now waking up to conduct research. Clinical trials have been carried out by countries even before, and this is the situation with some of the key indicators that I put on this slide. So with the COVID-19, a number of countries have proposed a number of traditional medicines to be used for the treatment or prevention of COVID-19 in the region. These are just examples from Tanzania, Schengen and Covidol, from Central Africa, Elixir, from Madagascar, COVID Organics, from Congo, Moringa, from Benin, Burkina Faso, Apivirine, from Gabon, Fagaricin. These are just examples of the products that have been proposed for this pandemic.
Excuse me, Dr. Ossy. So this question, it came from Ibrahim Makame. The traditional medicines in Africa are well known, as you have pointed out here, but why don't Europeans, this is the question, why don't Europeans use or believe in traditional medicines like we do in Africa? This is from Ibrahim Makame. Would you like to take that one, Dr. Ossy?
Thank you very much for this question. The European countries have not actually neglected, let's say, traditional medicine, because what they are using, what they call there, we call traditional medicine, but in Europe, they call complementary and alternative medicine. If we look at the data which we have received from the various countries, we see that the percentages of the respective populations having used complementary alternative medicine, at least once, 42% in the populations in Belgium, 49% in France, 80% in Germany, 90% in the United Kingdom, just to mention some examples. But I would also like to mention that 11 of the 53 countries in the European region have developed national policies on traditional and complementary medicine. And 15 European countries have established national offices or programs in the ministries of health, officially mandated and in charge of traditional and complementary medicine development. And also, the countries of the European Union are conducting research. For example, in Great Britain, the Department of Health has a program to develop research expertise in traditional complementary medicine and strengthen the evidence base. It also commissions periodic surveys of the use of traditional medicine in that country. And finally, as some of you may be aware, the European Union established the European Medicines Agency, or EMA, whose scope of operations is medicinal products for human and veterinary use. And is also responsible for the Committee on Herbal Medicinal Products, which issues scientific opinions on herbal substances and preparations. And therefore, if Europe was not interested in traditional medicine, they would not be doing all these things. So all the facts and figures I've just mentioned indicate that Europe is actually using what they call complementary and alternative medicine. And in fact, they are very much advanced in terms of regulation of the practitioners and regulation of the products, whereas the African region is second to this region in terms of regulation and regulation of the products. So I can say that this is the situation at the moment. Thank you very much for your question. Over to you, Mr. Moderator.
Thank you, Ossy. Dr. Jaya, as a journalist, how can we digest the information we've gotten right now and make a good and informative story?
Thank you, Tole, and thank you, Dr. Ossy, for those very succinctly put set of facts and figures around traditional medicine from not just Africa, but also from Europe. Very, very interesting stuff indeed. And let me thank Mr. David McDonald and the East and Southern Africa Interagency Working Group for risk communication and community engagement for organizing this very, very timely and very, very newsworthy kind of a topic. This is going to be, let me warn you, it's going to be a tough one for journalists. It's a very, very tough area to cover. And we're going to have to learn a lot of technical information, stuff around policy, as well as stuff around things like validation and standardization, which Dr. Ossy is going to explain in a little while. And also stuff around trials and how to report on the numbers and the outcomes of clinical trials. And what about rumors and that sort of hype, and how does one handle rumor and misinformation and disinformation around it without sort of debunking traditional medicine altogether? I mean, this is a minefield of it's a huge challenging thing for journalists to cover. But just to add to what Dr. Ossy was saying, there's a lot of interest in traditional medicine, and this interest has been sort of growing over the years. And as someone from India, I can tell you that just in 2019 alone, the export market for Ayurvedic, Unani, Siddha, and other Indian, Asian herbal medicines was something in the range of about $450 million US, and the Indian government has set up a separate ministry of Ayush to sort of undertake research into this area. So I think for journalists, it's really interesting, the slide that Dr. Ossy showed about how many medicines in Africa that come from traditional healers have actually been authorized for marketing. And if you compare that very tall bar graph at the beginning of the slide, and move your eye to the right, you'll see that the graph goes down, and those are data that deal with legal frameworks and that deal with, curricula development, that deal with research and so on. So what's really interesting is the questions we need to really ask ourselves is, take a very, very serious look at traditional medicine, but learn how to cover it in partnership with experts. You really need to talk to experts all the time, talk to researchers all the time to understand how these trials are being done and how the outcomes are being captured. So I think that's really important. The second thing is there's a common, sort of a feeling amongst journalists and among the general public that traditional medicines have no side effects. That can't be entirely true. Even if you eat too many potatoes, there are side effects. So it's time that we start improving the quality of commentary, make it a little more nuanced, add a little more layer of complexity instead of trying to report on traditional medicines in black and in white. But we'll go into this in a little while, how to report on the clinical outcomes of these trials that are going on. But I'll turn it back to Ossy, but suffice to just conclude what I said by saying this is a huge multi-million-dollar industry that's growing all over the world. And traditional medicine does hold out a lot of interesting areas for exploration for new pandemics like COVID-19. It's something that we really have to work very, very hard to try and understand and cover. So back to you, Tole.
Thank you very much, Jaya. Before we go back to Ossy, there is a question. Thank you very much, Anyar Kuol. He says some local people where he comes from who have access to traditional herbal medicine do take the mentioned ingredients without being processed and use them to treat diseases. How can such people who have gained trust in herbal medicine healing be engaged to submit their work to science to enhance safety of use? That can, I think both of you doctors, so one as a journalist and the other one as a practitioner. We can begin with you, Jaya.
Yeah. Yeah, actually, I think Dr. Ossy should take it first, but I can tell you something that which should probably confirm what I'm saying, which is that a herbal medicine is essentially, it's a formulation. It's never just one single thing, like a vegetable or something. So it's usually prepared and made, and it could be a combination of several things. So it's a formulation, and which is supposed to give you in a graded dose, a certain dose of something to be eaten along with a prescribed diet at a particular time of the day and, over a period of time and so on. So taking the ingredients separately is not a good idea. That's not what traditional medicine would recommend, in my opinion, but I'll turn it over to Ossy here.
As I mentioned before, we said that because there are all these variations of traditional medicine, we had to divide them into those 4 categories. So I see that the category you are talking about is category either 1 or 2. Let's say it's the community you said. So it's category 2, where those people in those communities, they know very well that these products are used for this ailment. So these medicines they take them either as powders, as leaves, decoction, or whatever, or roots. But, and sometimes they mix them together so that they take it as the whole formula. And this whole formula will be containing a number of, a lot of active ingredients which have not yet been tested. And some of them, of course, they work. This is why 80% of the population use these medicines. But we want these medicines to have another look, to be more presentable, so that we can be able to sell them for the social economic benefits. And that's why, and also we want to verify scientifically that they are actually efficacious, they are of good quality, and they are safe, most importantly. And that's why, we conduct this type of research. Of course, We cannot tell them that, we continue to advocate that, the medicines that are being used have to be subjected to research. But of course, we will always have communities and traditional healers who will continue to use these medicines as generation, go by. But I believe after many generations, we may not find anymore this kind of medicines that are used by healers and communities, but because all of them, or majority of them, would have been subjected to research. This is what was happening also in other countries, in Europe, in Germany, in Italy, in the UK. In the past, they were using these medicines like this, even in Africa, before the research was introduced. So it's a process that we need to continue to advocate, and we need to continue to build the capacities of countries, and we need to continue to inform the communities, and of course through you, journalists. When you write good stories and you write the correct facts and figures, this information will be read out by these communities, and slowly the situation will change. So I am throwing this challenge back to you, that as we go along with not only this dialogue, but other dialogues, you will continue to search information, in institutions and websites where normally there is a good source of information. And you will also be able to visit some of our WHO offices in countries, so that because there you also have journalists and experts in various subjects, so that you can make this network to ensure that all the time you report the right information, or you can send it to us in the regional office. Within an hour or so, we can respond to you to say, this is what we think you should do.
So thank you very much. Another question has come in from Muluken Samuel. He says he's from Ethiopia, and he's working on the COVID-19 response activities. And he says Ethiopians believe in the herbal traditional medicine, but he collects a lot of rumors from citizens on what they believe in. So to what extent, he asks, should they advise them to use the herbal medicine? As you know, the issues of side effects are there.
I think they should not advise them to use herbal medicines, because so far there is no herbal medicine that has been found to be safe and efficacious and assured for COVID-19. The studies are going on. There are some countries which are in phase 1. There are those that are in phase 2, and soon we will support them to carry out phase 3. And there are those which are in preclinical safety testing. So my advice to them is that they should send them to health facilities to be treated with the standard treatment of care that is recommended by the government. I know there's no cure, but the people are still being treated. And it doesn't mean that if somebody has got a COVID-19, that is the end of it, somebody will die. Majority of the people, they recover, they recover themselves, and some others, with mild symptoms, they are treated with the standard treatment recommended by the government. It's only those severe cases which, and in older people that have been dying so far. So this is my advice for the moment, no traditional medicine for COVID-19. Thank you very much.
Okay, thank you very much. Jaya, sorry, before I get to you, let us go to David. Then after that, we'll go back to Jaya. David.
Yeah, thank you, Tole. And once again, thank you, Dr. Ossy and Dr. Jaya. This is, as you mentioned, this is a timely subject, and it's an important subject. And I'm glad that we're able to address it right now. as we've done for all of those who've attended our previous media dialogues, right about now is when we just take a quick break. We're going to launch our poll for the topic for the next media dialogue. We're talking about health journalism here, and we're talking about a lot of serious issues, but a lot of times we find that we're sitting in front of a screen for so long that we forget to get up and move around, and sitting in front of a computer for such a long time is it's not healthy. So this is what we do in the middle of our media dialogue right now is we take a break and I try out my DJ skills, which I think they've been getting a little bit better. And we're going to play 1 minute of music from a song that is, well, if you don't know it, you should look it up because it's a great song from African musicians all over, talking about Let's Stand Together. All right, and here comes my DJ skills.
One day, my people, one day we be celebrating, 'cause this plague is over. Nothing will be separating us, 'cause nobody is safe until everybody is safe. Oh, everybody is safe. Oh. One day, my people, one day we be celebrating, 'cause this plague is over. Nothing will be separating us.
Alrighty then. One day, my people, we're going to get over this.
That was great.
You like that little? All right.
Absolutely, absolutely. So
Well,
before
you
we
know
go,
what? The next time we're going to keep the video on for everybody and see if everybody's getting up and moving around a little bit and having some fun, getting the circulation going, Yeah. Anyways, thank you very much for that break. Thank you for the respondents who are already starting to vote on our poll. And Tole, back to you. Let's go into the second half of our media dialogue.
Yes, thank you very much. I like when I see questions coming in. There's a difference between illness and disease, which he believes are two distinct issues, have to be well understood. So he's asking, how can we mainstream this in modern medicine?
I think it probably means the difference between infection and disease. So just because one has a viral infection, I mean the SARS-CoV-2 infection, it doesn't always cause illness. That's symptoms and bodily damage in many people, a good proportion of the people. So we have to make that very, very clear. And Dr. Ossy was saying it's like the vast majority of people who contract the virus don't really fall very sick with it. There's a good proportion of them who remain asymptomatic. Some have mild symptoms, some have moderate symptoms, and only a very, very small percentage of them actually progress to falling really sick with severely ill COVID-19 disease. So, and those are people who usually have some kind of underlying condition, a comorbidity, that is another disease at the same time as COVID-19, which pre-existed COVID-19. And that's usually diabetes or high blood pressure. Some of them have, are of old age with depressed immunity and so on. And in people like that, obesity is also linked to COVID-19, increased severity of COVID-19. So in those people who already have pre-existing lung conditions, for instance, whose lungs are already damaged, those are the people who are more likely to come down with a more severe form of the infection. And, some of them end up in the intensive care and require oxygen and life support and so on. So I think if we talk these bits of information through to people, it would help them understand the difference between being infected and actually having disease. It'd be good to break down this whole spectrum. At the same time, by telling people that a high proportion of them will remain asymptomatic, we should make it clear that being asymptomatic doesn't mean that you can't infect other people. You could be asymptomatic and have taken a test, tested positive, and you absolutely need to wear your mask, maintain physical distancing, and ensure that you wash your hands. And even if you haven't taken the test and you may not know whether you're positive or not, it's all the more important if you're asymptomatic and feel well that you absolutely have to maintain these same precautions that will prevent the transmission of the virus in the community. Back to you, Tole.
Okay, thank you very much. For those people who are having symptoms of vomiting and diarrhea, do you think COVID-19 is the one causing that?
Sorry, Tole, I have to clarify that. If you have symptoms of vomiting or diarrhea or sneezing or loss of smell or whatever it is, unless you take a test, you will not know whether you have SARS-CoV-2 infection or not. It's just that you have to be, you have to confirm it with a test. They either do the nasal swab and have it checked by the doctor so that you know whether you're infected or not, but follow all the precautions regardless.
Another question from Esther Nakazi is asking about the efficacy of the Madagascar herbal treatment. Since it's been some time since people started working on that, are the results in yet?
We have been working with the scientific committee of Madagascar to prepare them to conduct a phase 3 clinical trial. The information we have from the country was that they had done some clinical studies, but we don't have we have only the preliminary data on this, and also they carried out preclinical safety and efficacy testing. But we don't have the data from the government, so I cannot say that where the stage is at the moment. But I can for sure tell you that the phase 3 has not been carried out, so we cannot say that COVID organics is safe, efficacious, and quality assured as of today. However, as soon as the study is completed, the government of Madagascar will announce the results of this clinical trial. This is what I can say at the moment. Thank you very much for the question. We have been talking so far about traditional medicine and Western medicine, etc. But I want to make one point which is very important to all of you, that the criteria for the safety, efficacy, and quality of medicines is the same, whether we are talking about traditional or Western medicine. And I had mentioned earlier that it is for this reason that even traditional medicines have to be subjected to clinical trials. Before I talk about the protocols, I would also like just to inform you that about the examples of ongoing preclinical and clinical trials in our region. We have the countries mentioned like Ghana, Burkina Faso, Congo, Democratic Republic of Congo, Guinea, Madagascar, Mali, Nigeria, South Africa, Tanzania, and Uganda. This is the information that we received from the countries. As I said, we will have more clarity at which level exactly these countries, how far they have gone with the research next week, starting Monday. Now, in order to ensure that the traditional medicine meet this criteria of safety, efficacy, and quality, WHO has developed a master and a standard protocol for countries for the study of the clinical trials for the medicines that they proposed, as I showed you before the slide. So these studies are multi-center, which means that a clinical trial will be carried out in more than one medical institution. And secondly, the recruitment of study patients must be more than 2,000 plus for the results to be statistically and scientifically acceptable. And thirdly, the patients must be randomized, meaning that the study participants will be randomly assigned to treatment arms as well as to the control arm. For example, you might use a simple random sampling where participants' names are drawn randomly from a pool where everyone has an even probability of being chosen. And finally, the study must be double blind, meaning that neither the investigating doctor nor the patient do know about the treatment and the control arms. So the treatment arm is the one with the traditional medicine being tested, and the control arm is the standard care that is recommended by the national governments. Now, in addition to this, we have also developed a document on the potential contribution of traditional medicine for COVID-19. Is a guide for COVID response, where we underscore the importance of collaboration between traditional health practitioners and conventional health practitioners in research, and the importance of them signing a memorandum of understanding or an agreement before they start this collaboration, which provides for the roles and responsibilities of the two parties, as well as royalties should a traditional medicine be commercialized from this collaboration. The traditional medicine practitioners need to be remunerated. Then we have established an expert advisory committee on traditional medicine for COVID-19 together with the Africa CDC in order to support the countries through training and monitoring of the clinical trials, the various sections that I just mentioned before. The people need to be trained, not that they don't know, but all the investigators, they are not always the same people. They need to know what are their roles and responsibilities so that they will be ready for the study, for everybody to be on the same page. Now, we have also established another independent committee so that people will not say, oh, this is a WHO and Africa CDC expert committee. They are just telling the organization that these medicines are safe. So another independent committee that will be responsible for advising on the continuation or termination of the studies depending on the situation, but also they'll be responsible for advising on the safety and efficacy of the product. And of course, at the end of the study, which will take about a year or so, the sponsor, which can be the government or WHO and Africa CDC, will announce the clinical trial outcomes at the end of this study.
Yeah, just a couple of terms that we used in the last slide that might help journalists to sort of think about. One of the terms is, the randomized double-blinded trial. And if you could just explain what that is so that the journalists get it right.
Okay, I had just explained to them that the patients must be randomized. It means that the study participants will be randomly assigned to treatment arm as well as to the control arm. For example, you might use a simple random sampling where participants' names are drawn randomly from a pool where everyone has even probability of being chosen. And the double blind, it means that the investigating doctor and the patient are not aware of the treatment and control arms. The treatment arm is the one with the traditional medicine being tested, and the control arm is the standard of care recommended by the national governments.
Dr. Jaya, what kind of stories can journalists come up with data and information like that?
Yeah, it's important when a traditional healer comes and starts promoting traditional medicine as a cure for COVID-19 to remember what Dr. Ossy said, that at the moment we don't have a traditional medicine that can cure COVID-19. That's the first thing. And the second thing is to ask what kind of tests the traditional medicine went through before he's making his claim. So if the journalist asks him, was it part of the government's randomized controlled trials? Did it go through a randomized controlled trial? where essentially two groups of people, there are two groups of people and there's no difference between them except that one group gets the traditional medicine and the other one gets whatever treatment is now being used. So that's the only difference. So that you can measure whether the traditional medicine is actually having a beneficial effect on COVID-19 or not. So these are the questions that the journalists really need to ask. Randomized controlled, double-blinded, placebo-controlled trials are the gold standard, and that's a word that journalists really need to get familiar with, very, very familiar with. Unless a traditional medicine passes a randomized controlled trial, the way Dr. Ossy described it, you really can't come to a conclusion about its value for COVID-19 or to treat anything else.
So what I explained so far, in the last slide, is what we call the science and traditional medicine. You know, that traditional medicine are subjected to the same standards of research as modern medicine. Now, what are the advantages, the implication of this science? It just means that the traditional medicines will have gone through a systematic research through the clinical trials and the steps that I have mentioned to validate this traditional medicine. It means there will be standardization of the dose of the medicines, and it means that when this medicines is safe, efficacious, and quality assured, it has to also to be affordable to the population because it would be locally manufactured. And therefore, it will add to the arsenal of pharmaceuticals to improve access to medical products in that particular country. It will also mean that traditional health practitioners will be recognized because they are the ones who provide the information to research institutions. And in fact, they contribute a lot because the researchers, they don't have to start the research from scratch. They already know that I have to look for these effects in this particular product because the traditional healer will have already said this medicine is used for this and that. So it just goes there to confirm what the healer has said. It also means that the products and the practitioners who are well informed, well and licensed, they will be integrated into the national health systems, the practitioners into primary health care, as already enunciated at that time already in 1978 by the Alma Ata Declaration. There are also socio-economic dividends, which I mentioned, but I used the word royalties. But for this to happen, it means that a traditional health practitioner must sign that memorandum of understanding I was telling you. Otherwise, when the product is already there, they are selling, they may not give him or her or the communities where the resources come from, they may not give them.
Excuse me, Dr. Ossy and Dr. Jaya, I'm going to have to be the bad guy moderator because we only have 3 minutes left, and all the questions that we still have out there, no problem, we'll pass them along to the panelists and try to get some answers for you. Yes, we'll get the slides for you. I know that Dr. Ossy had one more important slide, but she also had a bunch of great contacts for journalists to go to when you need it. So we do only have 2 minutes left because we try to get out of here at right at 50, and which is up in 2 minutes. There's a little bit of time left for the poll. So far, we only have, it's neck and neck between number 1 and number 4. So if you want something to say about which topic you want for the next one, you better get in there in the next minute or so, because we're going to wrap it up. Toli, would you like to wrap it up? Like you say, we're going to send all the slides, so it'll all be good. Take it away, and I will stop being the bad moderator.
No problem, no problem. Yeah, so there's still questions on intellectual property, which will be forwarded to the panelists and answered and sent back to you. Thank you very much for taking your time and being part of this media dialogue. Be on the lookout for the next one. And we are very happy to receive any questions from you, even after these interactions. We will most definitely have some responses for you. Thank you very much and enjoy the rest of the day wherever you are.
Thank you, Tole. Thank you, David. Thank you, Dr. Ossy. And it's a pleasure to have been part of this panel discussion. Enjoy and happy story writing.
Thank you very much, the two moderators, and thank you, Jaya. It has been a pleasure to work together. You know, it's always very interesting. Next time we'll need more time, but I think we've covered ground. Thank you.
Yeah, we'll be sharing a tip sheet on how to report on traditional medicine soon, and you know, we'll have Dr. Ossy have a look at it and share it out to the group.
Absolutely. Thank you very much.
Thank you very much for the invitation to all of you. It was a pleasure working with you, and we hope that we'll work together very soon.
Yes.
Okay, thank you and bye.